Welcome back guys. Now in this video let's discuss about cortisol as well as Cushing syndrome. So before discussing about cortisol you should know from where exactly the cortisol is getting produced. See, please look at here. Here I am showing you the adrenal gland. Okay, we all have two adrenal glands which are sitting on the top of the kidneys. Now let's divide the adrenal gland into parts. Okay, the innermost region, okay, this innermost region which I am showing you in this light green color is called as the adrenal medulla. Okay, the adrenal gland is divided into adrenal medulla as well as the outermost part is the cortex. See, this outermost part, okay, is the cortex which is shown in the pink color, as well as this green color area which is in the center. This is called as the adrenal medulla. Now let's divide the cortex again into three parts. The adrenal cortex is further divided into three parts, which is zona glomerulosa, zona fasciculata and zona reticularis, from outside to in. Okay, from out to in, the cortex is divided into three parts. Okay, GFR, glomerulosa, fasciculata and reticularis. So GFR is a mnemonic. Now the innermost part is the adrenal medulla, we know. Now this adrenal medulla, okay, it produces what? See, this adrenal medulla, it's having cells called as the chromaffin cells, and these chromaffin cells of the adrenal medulla are going to produce hormones called as the catecholamines. Okay, catecholamines. What are the examples of catecholamines? Adrenaline, noradrenaline, dopamine. Okay, epinephrine, norepinephrine, dopamine. So these are the catecholamines which are producing from the adrenal medulla. Now the zona glomerulosa. So zona glomerulosa is producing the mineralocorticoid which is aldosterone. We have discussed in detail about the aldosterone in the topic of renal physiology. Okay, now next fellow is zona fasciculata. Next part is the zona fasciculata. This zona fasciculata, it produces glucocorticoids. The example of the glucocorticoid is, yes, cortisol. So cortisol is produced from where? Cortisol is a glucocorticoid. Why we are calling it as a glucocorticoid? Why? Because it is associated with the glucose regulation. Okay, glucose metabolism. Okay, glucose regulation, and it is producing from the cortex, adrenal cortex. So corticoid. So glucocorticoid is our cortisol, and the 6 corticoids like dihydroepiandrosterone sulfate. Okay, so these are the weaker androgens, androsterone, dihydroepiandrosterone sulfate. These are the weaker androgens which are produced from the zona reticularis, the innermost part of the cortex. So anyway, the one point which I want you to know is, sir, cortisol is a glucocorticoid produced from zona fasciculata. Okay, when so the stimulus for the release of this cortisol is ACTH. Okay, so ACTH is produced from the pituitary gland. The corticotropes of the anterior pituitary gland is going to produce the ACTH, and that ACTH will come and stimulate the adrenal gland. Now adrenal gland, under the stimulation of ACTH, it will release the cortisol. My questions for you. See, the cortisol is what kind of hormone? This cortisol is a catabolic hormone. It's not an anabolic hormone, it's a catabolic hormone. Okay, it's a catabolic hormone and it's a steroid. Of course, it's a steroid. Why? Because it is derived out of cholesterol. Cholesterol is converted into the cortisol. Okay. Now, let's talk about the different effects of cortisol in our body. Okay, cortisol acting on different systems, and how excess cortisol will cause Cushing syndrome. We'll discuss. Now, let's see what cortisol is doing to the carbohydrate metabolism. Carbohydrate, simple. One point I want you to know. Cortisol increases the blood glucose levels. Okay, cortisol, it is a hyperglycemic hormone. It increases the blood glucose levels. That's it. One point I want you to know. That's it. Now, what cortisol is doing? Okay, what cortisol is doing to the proteins? Cortisol is a catabolic hormone, so proteolytic. So, decreases protein synthesis. Okay, decrease protein synthesis everywhere in the body, or proteolytic I should say. Okay, proteolytic. Okay, everywhere in the body. But in the liver, okay, in the liver, it helps in production of plasma proteins. So in the liver it is anabolic. What it is doing? Cortisol acts on the liver, increases the production of plasma proteins, but elsewhere in the body it decreases the protein synthesis, or I should say proteolytic. Cortisol is a catabolic hormone. Okay, it's a stress hormone. Cortisol is a stress hormone. Stress hormone. Why it is called a stress hormone? We'll discuss. Okay, why it is called a stress hormone? We'll discuss. Next, in the liver, what it is doing? See, and I should say the cortisol, what it is doing to the fats? Same, lipolytic. L-I-P-O, lipolytic. Okay, cortisol is lipolytic. Decreases the fats or causes the lysis of the fats. And cortisol, what it is doing to the immune system? See, in the immune system, cortisol it's a steroid, right? Cortisol is a steroid. So we all know steroids are the immunosuppressants. They are anti-inflammatory as well as immunosuppressants. So what happened to the immune system? Suppression. Okay, let me write it down here. Immunosuppression. suppression. Okay, immunosuppression as well as anti-inflammatory. Okay, anti-inflammatory. Now, after this, let's talk about the blood cells. What this cortisol is going to do to the blood cells? See, usually cortisol will decrease all the blood cells. Okay, all, especially the WBCs, all the WBCs, immunosuppressant, right? All the WBCs will go down except, okay, except the neutrophils. Okay, so when you have cortisol increases the neutrophils, but all the other WBC, okay, other WBC decreases. Neutrophils increases as well as sometimes eosinophils will also be increased, but neutrophils decrease. When I talk about the RBC, see RBC, platelets. What happened to the RBC and platelets? They are increased. Platelets are increased, RBCs are increased, and neutrophils are increased. There is a neutrophilia. Okay, neutrophilia when you have cortisol. Now, what happened to the heart? See, I exactly don't want to speak about the heart. Most important point regarding the cardiovascular system, the effects of cortisol on the cardiovascular system is cortisol is important in maintenance of the vascular tone. It maintains, okay, cortisol maintains vascular tone, or I should simply say it causes the contraction of the blood vessels. Okay, increases the BP. Now, on bone, what cortisol is doing? Catabolic. Okay, even bones are getting destroyed, osteoclasts will be activated, that causes bone resorption. Okay, bone resorption. Okay, cortisol, what it will do is it will inhibit. This is one of the important MCQ. What cortisol will do is cortisol inhibits the conversion of the osteoblastic precursors into osteoblasts. So, what cortisol is doing? Cortisol inhibits the conversion of osteoblastic precursors into osteoblasts. So, what happened to the osteoblast? Number of osteoblasts are going down. So, no osteoblasts are there. So, no bone formation. On the other side, the same cortisol, it will produce rank ligand. Okay, or I should say osteoclasts cortisol activate the osteoclasts. Osteoclasts are activated. When you have osteoclast, bone resorption will happen. So, bone breakage. Okay, bones are getting broken down. That's happening under the influence of the cortisol. Okay, done. Now, what it is doing to the connective tissues? See, especially here, okay, I want to talk about the collagen. See, collagen is there in the connective tissues. That collagen is getting broken down. Okay, collagen is getting broken down. Okay, because of that, what will happen, we'll discuss later. So, collagen is getting broken down. On GI tract, cortisol in the stomach, it will increase the acid production. Acid production. Okay, on reproductive system, see, cortisol is a stress hormone. Okay, it is produced during stress. What cortisol will do? In the first point I have explained to you. Cortisol increase the blood glucose levels. By using this glucose, you can plan the things. Okay, you can either fight or you can flight. Okay, under stress. Okay, you need to come out of the stress, right? So, if you want to come out of the stress, you need the glucose. So, that's why cortisol is a stress hormone, because it increases the blood glucose levels. Okay, it helps you to fight with the stress. It causes vasoconstriction, increases your BP. Okay, so it helps you to fight with the stress. So, in GI tract also, it increases the acid production. Okay, well and good. The point here is, it's a stress hormone. During stress, do you need any reproductive activity? Definitely not, right? So, all the reproductive hormones will go down. Or I should say the hypothalamic-pituitary-ovarian axis or the hypothalamic-pituitary-gonadal axis will be inhibited. So, inhibition of hypothalamo-pituitary-gonadal axis. Okay, hypothalamo-pituitary-gonadal axis is inhibited. Okay, inhibited. How? Because of this inhibition of hypothalamo-pituitary-gonadal axis, what exactly I mean by is decreases the FSH levels, decreases the LH levels, decreases the FSH, decreases the LH. So, gonadotropins, these gonadotropic hormones FSH, LH are going down. Okay. Now, what happened to the skin? See, skin is the largest connective tissue, right? It's the largest connective tissue. Skin, and it is also the largest organ. See, skin. What it is doing? Our skin is made up of collagen. We all know our skin is made up of mainly collagen. So, the collagen in the skin is also getting broken down. So, because of that, what happens? Skin will become more stretchable. Okay, skin is becoming more stretchable. So the skin is now more compliant, it will easily stretch. That will cause stretch marks. Okay, that will cause stretch marks, that we will discuss. But one point I want you to know is, see in this cortisol, what it will cause? It will cause hyperpigmentation. Okay, cortisol will cause hyperpigmentation. How it will cause hyperpigmentation, we will discuss in a minute. Okay, I am not writing anything here, we will discuss in a minute. First of all, see what cortisol is doing. Cortisol increases the blood glucose levels normally in stress. Cortisol increases the blood glucose levels. So during stress, cortisol is released, cortisol is increasing the blood glucose levels. But right now, let us discuss about the Cushing syndrome. That is the cortisol excess. When you have excessive amount of cortisol, what will happen? So continuously 24/7 cortisol is there. Now this cortisol, what it will do? Now this cortisol, it will increase the blood glucose level so much. Okay, so much blood glucose. So that will cause diabetes mellitus. So patient who is suffering with, okay, a patient who is suffering with Cushing syndrome is at a risk of developing diabetes mellitus too. Okay, Cushing patients will be having hyperglycemia and diabetes mellitus. Now let's talk about the protein thing. Okay, normally cortisol, it decreases the protein synthesis. Okay, decreases the protein synthesis. Now because of that, in Cushing syndrome, what will be happening? Now cortisol normally is causing proteolysis. Okay, decreased protein synthesis, or I should say proteolysis. Now here, a patient who is suffering with Cushing syndrome, there is more proteolysis or breakdown of the proteins. Proteins means they are present in the muscles. So muscles are getting broken down. Okay, we don't know the exact reason why, but mainly the proximal muscles. Okay, the proximal muscles. Okay, the thigh muscles or the arm muscles. Now they are under attack. Cortisol is causing the breakdown of the proteins inside the muscles. So that will cause what? They will use this classical word which is proximal myopathy. Why? Because the muscles are getting damaged because of the proteolysis. So muscles are getting damaged. So they will use the word proximal myopathy. Okay, so in Cushing syndrome, there is proximal myopathy. Okay, well and good. Now let's talk about the fat metabolism. See, cortisol is lipolytic, right? Now the lipids are getting broken down, adipose tissue is getting broken down. Now usually, okay, students will think, sir, cortisol is it's a catabolic hormone. Yes, it is lipolytic. So all the lipids in the body are going to be lysed, so that the patient will be going up. Okay, they're going into a thin shape? No. Okay, no. See, Cushing syndrome is a hyperglycemic state. Okay, hyperglycemic state. Now all this glucose, okay, all this glucose need to store somewhere. Okay, we need to convert this glucose. Okay, whenever you have hyperglycemia, even counter regulatory hormones are produced. Okay, now you are having hyperglycemia, 24/7 high levels of glucose is there. Now whenever there is this glucose, insulin will be produced. Now what this insulin will do? Insulin stimulates, okay, insulin stimulates lipogenesis. Cortisol is lipolytic, okay, no doubt. Okay, cortisol is doing the lipolysis. On the other hand, what is happening is, say, more glucose is there. We know whenever there is glucose, there is insulin. What insulin will do? In the previous video we have studied, insulin is stimulating the lipogenesis, adipose tissue formation. Especially in Cushing syndrome, more glucose, more insulin. Insulin will cause hypertrophy of the adipocytes. Okay, insulin will cause hypertrophy of the adipocytes, lipogenesis, especially in the central axial skeleton. So that these patients will be having moon-faced. All this adipocyte hypertrophy, this adipocytes, the fat is getting stored, especially in this neck region, which is causing the buffalo hump. There is moon faces, okay, round puffy face with the moon face with the buffalo hump. Moon face will be there, buffalo hump will be there, and the axial skeleton, because of the adipocyte hypertrophy, the patient is going to be little bit obese. That's exactly the word they will use is a central obesity. Okay, central obesity. Everywhere in the body there is lipolysis happening. Because of the hyperglycemic states, more insulin is there. Insulin will stimulate the lipogenesis, especially in the central axial skeleton of the body. That will cause central obesity. Okay, let me write it down here. The keywords, moon faces will be there. Okay, moon faces, buffalo hump. Okay, buffalo hump and centripetal obesity. Okay, centripetal obesity. The patient is going to have centripetal obesity. So these are the some important points which I want you to know. Usually, yeah, people will think cortisol, it's a catabolic hormone, so lipolysis will be happening. Yes, lipolysis is happening, but in the central axial skeleton of the body, there is adipocyte hypertrophy that will cause the lipid accumulation, that will cause the moon phases, buffalo hump, as well as the centripetal obesity. Even in these images, you can clearly see. So now this female, now she is suffering with the Cushing syndrome, where you can clearly see the face is now more puffy, it's more of round shape. This is the moon phases, and you can clearly see here the buffalo hump. This is the buffalo hump. Okay, it's a fat pad. Okay, dorsal fat pad. The fat is getting accumulated over there. Okay, well and good. Now what about the immune system? See, cortisol is anti-inflammatory. Okay, anti-inflammatory as well as immunosuppressant. Now, inflammation is not there. Inflammation is actually good. It kills the bacteria. And immune system is good, right? Immune system is trying to protect your body from the bacteria or the infections. Now, when you have excessive amount of cortisol, immunosuppression. Whenever there is immunosuppression, these fellows, okay, these patients who are suffering with the Cushing syndrome, they are at a risk of, okay, they are at a risk of infections. This immunocompromised state will cause the risk of infections. Okay, done. Same here also. Increase neutrophils or decrease in the other WBC. Okay, decrease in the other WBC will lead to the recurrent infections. But one important point which I want you to know is, see here, the platelets are increased, RBCs are increased. When the RBCs are more, hyperviscous blood, viscosity of the blood is increased. Even platelets are more, okay, viscosity of the blood. Now this viscosity of blood will cause thrombosis. Okay, see, normally the blood should be not viscous. It should be like normal, like water like. When you have more viscous blood, that will cause alterations in the blood flow, which will become which will favor more coagulation, which will favor more coagulation. So that will cause thrombosis. Okay. Okay. So hypercoagulative state will cause thrombosis. Even platelets, the damage to the platelets will release things which will favor the formation of the clots, that is the thrombosis. Now on heart, on the cardiovascular system, I have explained to you the cortisol is maintaining, it's very important hormone, the maintenance of the vascular tone. Now cortisol is not there. Whenever the cortisol is not there, whenever there is excessive cortisol, what happens? Now the vessels are having more tone. Okay, the blood vessels are having more tone, in the sense they are constricting more powerfully. That increases the BP. Okay, that increases the BP. That is, what should I say? Increase BP or hypertension. Okay, hypertension is seen. Now, on bone, normally cortisol is causing the bone resorption. Now, excessive cortisol, excessive bone resorption. When excessive bone resorption, in the sense here, osteoporosis. Okay, so Cushing fellows will be having osteoporosis, bone destruction. Now on collagen, see, collagen is a fiber which is present in the connective tissues, right? Now collagen is getting broken down. Even this collagen is present in the blood vessels. Okay, the wall of the blood vessels are made up of collagen only. Now whenever the collagen is getting damaged, it's a proteolytic, collagen is also a protein. When the collagen is getting broken down, the walls of the blood vessels become weak. Okay, the walls of the blood vessels, they will become weak. Now it is very easy for the blood vessels to undergo damage. Okay, now these blood vessels are very much friable. Okay, it's very easy to break the blood vessels. So these patients, if they have a small injury or some little stress, even these blood vessels are ruptured, and that will cause bleeding. Okay, so these patients will be having internal bleeding, like small petechiae or purpura will be seen. Okay, so these patients will have petechiae, purpura. Okay, so petechiae and purpura will be there. Okay, these patients will be having bleeding disorders. Now, more acid production. Cortisol increases the acid production. Now, whenever there is excessive cortisol, excessive acid production. Excessive acid production will cause what? Peptic ulcers. So, Cushing syndrome, the patients will be having peptic ulcer disease, that is the gastric ulcers as well as the duodenal ulcers. Later, reproductive system. Normally, cortisol, what it is doing? Cortisol inhibits the hypothalamic-pituitary-adrenal axis. So, FSH levels goes down, LH levels goes down. So, without FSH and LH, do you think the follicular maturation, follicular development and ovulation will happen? No, not happens. So, what happens? In Cushing syndrome, there will be menstrual irregularities or amenorrhea will be seen. Okay, so these patients will be having amenorrhea or infertility. And last one, skin. See here, normally ACTH, adrenocorticotropic hormone. This ACTH, it can stimulate the melanotropin receptors. Okay, melanotropic receptor. This is something normal, ACTH. Normally ACTH stimulates the adrenal gland, so adrenal gland produces the cortisol. Okay, well and good. But in Cushing syndrome, see, what is the cause of Cushing syndrome? One of the cause of Cushing syndrome is a pituitary adenoma. You are having a pituitary tumor. Now this pituitary tumor is producing excessive amount of ACTH. Now this ACTH, what it will do? Now this ACTH, yes, it will come and act on the adrenal gland. Now this adrenal gland is making more cortisol. Okay, so this is one thing. Not only that, this ACTH, it will stimulate the melanotropin receptors. Okay, melanotropin receptors are stimulated. Now when the melanotropin receptors are stimulated, what happens? Okay, when the melanotropin receptors are stimulated, now more melanin is produced. That will cause hyperpigmentation. In Cushing syndrome, more ACTH will cause hyperpigmentation. Okay, hyperpigmentation in the skin. You can clearly see here, this patient's Cushing's patient will be having hyperpigmentation in the mucosal membranes or in the skin. Not only that, please see here guys, the connective tissues, the collagen is present in the skin. Now the skin lost its collagen. Okay, and also remember, this patient is having centripetal obesity. Okay, he is becoming obese. Now this obesity will cause stretching of the skin, that will cause stretch marks. Okay, so this patient, see here, the patient is having centripetal obesity with the stretch marks or abdominal striae. So these are some important clinical features which are seen in Cushing syndrome. So in this video, we have discussed the important actions of the cortisol in the body, as well as we have seen what happens if there is excess cortisol, that is the Cushing syndrome. So both normal functions of cortisol on one side, on the other side we have discussed about the clinical features which are seen in the Cushing syndrome. Hope the video is helpful. Thank you.